Hello, this is the third part of my assignment. My name is AAdano, and this is assignment for a peripheral joint mobilization by Karen Bustillo. And before I start with the in doing mobilization for the wrist, I just want to explain about the mobilization that I did for the elbow. And the case mentioned that the patient is complaining more, or also complaining of considerable pain level on the elbow area. So I would suggest that all the mobilization that I did to focus more on grade 1 or 2, and to be less aggressive in terms of doing the speed or rhythm of the mobilization. So I'll be going to my patient now and to continue the last part of this mobilization, which is the wrist. And here we go. For the general flexion extension, this is how you do it. Our patient is actually only limited to 15 degrees of flexion and extension. So if you do flexion, the hand placement would be, palm and distal forearm. Same with extension. If you want to apply the mobilization in this position for the flexion, you might want to start with grade 1, just to test the joint or test the patient. Grade 2, large amplitude, but still not reaching the end range. Grade 3 will be larger, but to the end range. Grade 4 will be end range. The turn point will be smaller to make it small amplitude. Okay, for extension, just check if the patient can do 15 degrees of flexion and extension. To start with, grade 1, grade 2, resistance free. Grade 3 will be end range, large amplitude. Grade 4 will be end range, small amplitude. Okay, and based on my experiences, these mobilization will be good as well with some distraction. So you can distract the hand against a fixed forearm, and you can do flexion and extension. And as for progression, you could go from 15 degrees flexion to 15 degrees extension. Large amplitude, if it touches the end range, that will be grade 3. If not, then that will just be grade 2. You can do some overpressure, end range, overpressure, end range to flexion, and large amplitude, that will be grade 3. If you want to do grade 4, at the end range, do small amplitude, and then go back to flexion and small amplitude. For radial and ulnar deviation, radial deviation will be going to the direction going to the radius. Ulnar deviation will be going to the ulna. So it wasn't mentioned if it is limited, but just for the sake to complete the general motion of the wrist. So this is radial and ulnar. Okay, for the other mobilization technique, in response to concave and convex rule, the radial carpal joint, which is the wrist joint, the convex part of the carpal area is articulating against the radius. So the movement will be, if you want to increase flexion, what you have to do is dorsal glide. If you want to increase extension, that will be ventral glide. So let me demonstrate how the textbook suggested the antero-posterior and posterior-anterior glide. Okay, for the posterior-anterior glide, to increase extension, right arm of the, or right hand of the therapist will be like that, and left arm will be, or left hand will be like this. My fingers will be pointing to the elbow of the patient, and my mobilization force will be coming from here, from the distal area, going that way, going anteriorly against a fixed proximal area. So grade 1 will be barely doing it. Grade 2 will be larger amplitude. And that will be resistance free. Grade 2 will be to the end range and large amplitude. Grade 4 will be end range, and then return point will be shorter, so to have a small amplitude of mobilization. And if the patient can still tolerate, you can do overpressure with, you know, a little bit of flexion, and you can mobilize from there. Okay, for the dorsal glide or antero-posterior glide, to increase extension, you're just gonna be reversing your hand placement. So the left hand of the patient will be against the palm, and the right hand of the patient, fingers pointing to the elbow, will be over here. So the force that we want to do here is moving the distal part, especially the wrist area, against a fixed distal part of the forearm or the radius, and the force will be going to the feet of the patient. So, and you can also do a distraction here if patient could tolerate, and based on my experience, it's better to do that with, you know, with the actual mobilization. So grade 1 will be small amplitude, 2 to 3. Grade 2 will be larger, but still resistance free. Grade 3 will be larger and to the end range. Grade 4 will be small range, small amplitude, end range, and return point will be shorter. And as for progression, you could do all the mobilization grades with, you know, patient extending the wrist as well. That's a grade 1. Grade 2 will be larger but still resistance free. Grade 3 will be end range, large amplitude. Grade 4 will be end range and small amplitude. Okay, so that's the end of the assignment for this week, and I hope those mobilization that I showed were all appropriate for the patient, and I'll talk to everyone soon. Bye bye.